Dr. Scott Bulloch. I'm an oral and maxillofacial surgeon. I practiced in St. George, Utah for just over 30 years. And I'm going to talk about a very common question we get regarding wisdom teeth. Why do we have them anyway? And the answer to that is we're not really sure, but we do have some pretty good ideas because we can see genetic trends that are affecting wisdom teeth. Now, a genetic trend. So probably the most well-known genetic trend is that the average height for most people, especially in first world countries, is increasing. People are getting taller. At least some of us are getting taller. Our genetics are pushing us towards taller people, and also the nutrition helps with that as well. Now, with wisdom teeth, then we're seeing that the teeth have stayed the same size over generations, but the jawline has shortened slightly. There are a lot of theories that this may have to do with our diet, but bottom line is this is being handed down genetically. So genetically, we're crowding out those third molars, the wisdom teeth, so they don't have room to come in. Then they try to come in sideways, they push against the teeth, they create all kinds of problems, and they need to be removed. Now, the other factor that is significant with this is that if you go back in time before the days of surgery to take care of wisdom teeth and before antibiotics, then impacted wisdom teeth were very commonly fatal. Dental infections, especially with wisdom teeth, are one of the most common things they find in skeletal remains of early death in patients, people. So if people died young because of their impacted wisdom teeth, they did not then pass on that genetic trait to their children. Now, fortunately, it's not a big deal. You go to sleep, they're removed, you wake up, not a problem. So those genetics continue to be handed down. So impacted wisdom teeth have become the norm in our society at this time. Now, the other thing that's kind of interesting in our genetics is little by little, the wisdom teeth are starting to disappear. We see more and more patients that don't have all four wisdom teeth. They'll have 2 or 3 or none at all. Of course, there are those few unfortunate patients that have 6 or 8 wisdom teeth, but most of the genetic trend is towards fewer and fewer wisdom teeth. So maybe in a few more generations, they'll continue to dwindle, and eventually maybe they'll disappear altogether. By then, I'll be long past retired. So hope you learned something. Have a good day.